Hi, my name's Sarah. I'm a student nurse practitioner. I'm going to be doing your exam today. Your name's Kevin, right?
Yeah.
Okay, great. Kevin, do you need to use the restroom before we start?
No.
Okay. First of all, what's your height and weight?
6'6", 210 pounds.
Great. Place that under your tongue and hold it there till it beeps while I get your blood pressure, please. Okay, good. 122 over 70. Fine blood pressure. Normal temperature, 98.5. Well, next I'm just going to get your pulse. Okay, pulse rate 68. Your respirations are 16, which is fine, normal. Okay, I'm going to start the exam by looking at the size and contour of your skull. And also looking at the face here, making sure that the facial features are symmetric and in alignment on the face. Also looking for symmetry and alignment of the ears as well. I'm looking for any visible lumps on the skull or depressions or deformities, along with on the face, looking for color and any open lesions or swelling noticeable. I'm going to palpate the skull here. I'm checking to make sure that the scalp moves freely over the skull. I'm checking for any depressions or lumps or tenderness. I'm checking the hair for any coarseness or brittleness. Next, I'm going to palpate the facial bones for any tenderness or any lumps that may be noticeable or felt. I'm also checking here the maxillary region for any tenderness and the frontal region for any tenderness. I'm palpating here the temporomandibular joint. Can you open and close? I'm listening for any cracking and clench your teeth. I'm checking that muscle there for intactness of cranial nerve 5. And then lastly, close your eyes. Can you feel this, and is it equal?
Mm-hmm.
I'm checking the 3 regions of the face here for sensation, and that is intact for cranial nerve 5 as well. Okay, next we're going to move on to the eye exam. First, I'm just inspecting the eye. Like I said, for symmetry, any swelling. I'm looking at the eyelids for any redness or swelling. I'm also looking for the eyelashes and the eyebrows to be present as well. I'm also going to inspect the sclera of the eye and also the conjunctiva. I'm looking for any erythema, any swelling, any exudate. Very good. I'm going to palpate around the eye for any tenderness or any swelling or any sort of lumps I may feel. Any tenderness?
No.
What about in the lacrimal apparatus?
No.
Okay, very good. Okay, next I want to check the visual acuity, which also checks for cranial nerve 2. Please just look straight ahead for me. I'm going to first check the pupillary response here with a little light. Okay, I'm just looking to make sure that the pupils are round, equal, and reactive. Next, I'm going to check for strabismus with a cover-uncover test. Just look straight ahead. Very good. And I'm also going to check for cranial nerves 3, 4, and 6 by checking the extraocular movements of the eye. Just follow only with your eyes, please. And straight in. Good. And then I want to check for near vision. Also, to check for visual acuity, we're going to use the Rosenbaum test. Place it 14 inches in front of the eye. I'm going to cover one eye and tell me the lowest row.
428, 739. 428739.
Okay, great. And you have 20/20 vision. Very good. Okay, next we're going to move on to inspection of the ear. I'm going to look at the auricle behind the ear, and also I'm going to look in the outer ear canal. I'm looking for any redness, discharge lesions, or any swelling. Next I'm going to move on to palpating the ear. Any tenderness?
No.
Okay, I'm also feeling for any lumps. I'm going to check cranial nerve 8 by checking with a whisper test along with the Rene test, okay? I'm going to close this ear. Tell me what I say.
Apple. Carrot.
Good. Okay, now we're going to move on to the Rene test here. This is going to check bone and air conduction of the ear. So please tell me when you can't hear this anymore.
Okay. Okay.
And you want it to be twice as long for air conduction. So that is good.
Okay. Okay.
Good. And next I'm going to move on. I'm going to look in the inner ear canal and look at the tympanic membrane along with landmarks. I'm going to be inserting the otoscope here. Okay, I'm looking for any cerumen, any discharge or erythema, or any foreign bodies, lumps, swelling. And I'm just looking to make sure I visualize the tympanic membrane along with landmarks, and it is nice and pearly gray with no perforation. Inserting here. Okay, good. Same's noted on this ear. Okay, next we're going to move on to inspection of the nose. First going to inspect, I'm going to look for symmetry and placement. I'm going to palpate for any tenderness or lumps that I may feel. Next I'm going to check for patency of each nair. Will you please blow? Good. And I'm just going to tilt your head back a little bit. I'm going to look inside here first. I'm going to look for the mucosa. I'm going to look for any redness or discharge or any kind of masses I may see. I'm going to look to make sure turbinates are present, make sure there's no foreign bodies, and I'm going to make sure that the nasal septum is midline, no deviation and no perforation. Okay, next we're going to move on to the mouth exam. I'm first just going to shine a little light here so I can see better. I'm going to look at the color of the lips along with I'm going to look for any lesions or cracking. Next, just open your mouth here. I'm going to examine the inside of the mouth. I'm going to look at the teeth. I'm going to look for color, mouth odor. I'm going to look to see if there are any cavities on the teeth. And I'm also going to check for how many teeth are present. I'm looking at the buccal mucosa. I'm looking for color, moistness. I'm also looking to see if there's any open skin anywhere or any masses. I'm looking at the hard palate, the soft palate to make sure those are intact and there's no lesions. I'm also looking at the tonsillar pillars, and if the tonsils are present, that they sit nicely within the pillars. I'm looking at the nasopharynx. This general region, I'm just looking to make sure there's no lesions, any masses, swelling, or discolorations noted. You want the mucosa to be a nice red color. Like a pink color. I'm looking for the uvula to make sure that it hangs midline and it rises with awe. Okay, good. And then I'm looking here at the tongue. I'm looking at the size and symmetry. I'm looking at the color. Can you raise your tongue up for me? I'm looking at the base of the tongue along with the bottom of the tongue. And stick your tongue out for me. Good. It extends midline. And turn right to right for me with your tongue. I'm looking for lesions on the side and left. Good. So with the raising of the uvula, that indicates that cranial nerve 9 and 10 are intact. And then with midline extension of the tongue and the ability to move it right and left indicates that cranial nerve 12 is intact. Okay, next we're going to move on to checking for cranial nerve 7. If you could just run through a couple facial maneuvers for me. Smile, frown. Close your eyes tightly and raise your eyebrows, wrinkle your forehead. Good. Clench your teeth and puff out your cheeks. All right, good. Thank you. Next, I'm going to move on to inspecting the neck. I'm going to look for smoothness. I'm going to look for symmetry of the neck, make sure that the head is in a nice upright position. I'm looking for any goiters or any other lumps or lesions. Can you please move your head side to side? I want to check range of motion and up and down. Good. And shrug your shoulders. Good. And don't let me push you down. Very good. The resistance of the shoulder muscles indicates that cranial nerve 11 is intact. Next, I'm going to go on to palpating the neck. Is there any tenderness whenever I palpate?
No.
I'm looking for any lumps. I'm also checking to make sure that the trachea is midline, which it is. I'm not feeling any tracheal tug. I want to check the thyroid gland for any enlargement or coarseness. Just swallow for me. Very good. And then I'm also going to check each carotid pulse for rate and rhythm. Very good. Next, I'm going to palpate for any enlarged lymph nodes or tenderness the patient may have. Okay, tell me if there's any tenderness. I'm first palpating the occipital lymph nodes, posterior auricular, preauricular, tonsillar, submandibular, submental, superficial cervical, deep cervical, posterior cervical, and supraclavicular. And then lastly, I'm just going to auscultate for any breweries of the carotid arteries or the thyroid gland. Just hold your breath, please. Good. Okay, next we're going to move on to the arm and chest exam. If you could just take off your shirt for me, it'd probably be best for this portion. Just going to start inspecting the arms, the upper extremities for color, appropriate location, discolorations in the skin. I'm looking for hair distribution or any lumps that I may see. I'm going to palpate for warmth and any lumps or any tenderness that may be elicited. I'm going to look here at the fingernails for color, also for any clubbing that may be present, and just general appearance. I'm going to check the capillary refill in each one. I'm also going to check the radial pulses for rate, rhythm, and density, and also the brachial pulses for rate, rhythm, and density. Okay, next I'm going to move on to the back and posterior chest exam. First, I'm just going to inspect the posterior chest for symmetry. I'm going to look for midline position of the spine. I'm going to look for any curvature or deformity that I may see in the spine or anywhere else on the posterior chest. And I'm also going to look to see that the posterior chest expansion is equal. I'm also looking for any discoloration or open lesions I may see on the back or any lumps. Next, I'm going to move on to just palpate the back. Is there any tenderness anywhere?
No.
Okay, good. And then I'm going to percuss the costovertebral angle for any tenderness that may be elicited. Good. Okay, next I'm going to move on to the lung portion. First, I'm going to be inspecting the rate and rhythm and also the expansion of the lungs. I'm going to be listening for any stridor that may be present or looking for any distress in for the respiratory exam. After I inspect, I'm going to then percuss. I'm going to be listening for resonance. And then also on the lateral sides of the chest here. Thank you. And then I want to percuss here the diaphragmatic excursion of the lung. Breathe in deeply for me, please. Okay, and breathe out. Okay, good. Thank you. And then next, I'm going to be auscultating for breath sounds. Deep breath, please. Okay, good. Last two things, I want to check to make sure the expansion is equal on both sides. Good. And then tactile primitive, say 99?
99.
Okay, great. And then you can come around and we'll start the front of the anterior chest portion of the exam. First, I'm just going to inspect the chest. I'm looking for symmetry or any other deformities of the chest wall. I'm looking for any lumps or color discolorations that may be visible. I'm also looking for rate, rhythm, and expansion of the lungs. I'm listening for any stridor, and I'm looking to see if there's any intercostal or accessory muscles that are being used for inspiration. Okay. You can go ahead and lie back for me here. I'm just going to check for tactile primitive, say 99.
99.
Good. And then I'm actually set up here for me, I'm sorry. I'm going to percuss the front of the chest here for resonance. Good. And then I'm also going to listen to the front of the lungs. I'm listening as I did to the back for any crackles or wheezings or adventitious sounds. And I'm also making sure that with each inspiration, lobes are opening up equally and expansion is equal. Very good. Okay, now just moving on to the chest exam. I'm actually just going to have you lay back, and I'm going to examine for any pulsations or heaving over the chest wall. I'm going to feel for any pulsations, heaves, or lifts. Good. And I'm just going to palpate. I'm going to palpate the chest for any tenderness or lumps. No?
No.
Okay. Next, I'm going to check for any enlarged infraclavicular lymph nodes, along with in the axillary area for any enlarged lymph nodes. Okay, good. Okay, very good. Okay, I'm going to have you set up while I listen to your heart sounds here. I'm just listening for the S1 and S2 in all of the 5 regions of the heart. First with the diaphragm. Aortic area, pulmonic area, tricuspid area, Erb's point, and mitral area. Next, I'm going to flip over and I'm going to listen for any breweries in those 5 areas. Can you please hold your breath? Aortic, pulmonic, tricuspid, Erb's, and mitral. Okay, very good. All right, if you'll lay back, we'll start the abdominal exam. First, I'm just going to inspect for any pulsations, visible masses, or any bulging or edema, or ascites, that's visible in the abdominal area. Next, I'm going to auscultate the 4 regions. Starting with the right lower, just making sure that there are vowel sounds present. And then I'm going to use the bell and look for any bruits in the aortic area. Over the aorta. Iliac arteries. Let me start that over. The aorta, the renal arteries, iliac arteries, and then the femoral arteries. Very good. Next, I'm going to percuss just over the abdominal area here, and then I'm going to percuss for the size of the liver. Okay, very good. And then if you'll roll towards me, I'm going to percuss for the splenic dullness. Very good, thank you. Okay, next I'm going to do a little light palpation, looking for if there's any elicited tenderness or any masses that may be felt. Next, I'm going to deeply palpate those same areas. Okay, now I'm going to palpate the right marginal costum of the liver. Deep breath. Good. And then I'm also going to palpate for the left costal region of the spleen. Okay, very good. Okay, breathe out. And then for the right kidney, breathe in. Good. And same thing for the left kidney here. Okay, good. Lastly, I'm just checking for the aortic pulsation. And then tension muscles here, I just want to make sure they're nice and firm, which they are. Good. Okay, you can go ahead and sit on up. So we're going to check the lower extremities here. First, I'm just going to inspect for color. So for color, any edema that may be present, I'm looking for any open lesions and also hair distribution. Any tenderness when I palpate anywhere on your legs?
No.
Okay, I'm feeling for warmth. I'm also feeling for any nodules or lumps that may be present. I'm next going to palpate the pedal pulses, the posterior tibialis pulses, and also the popliteal pulses, all for rate, rhythm, and density. Now we'll move on to the cranial nerve exam. We've already done cranial nerve 2 testing for vision, cranial nerve 3, 4, and 6 testing the extraocular movements, cranial nerve 5 with the muscle of the facial muscle with the temporomandibular joint, along with the facial sensation in the 3 regions. Cranial nerve 7 when we did the facial movements. Cranial nerve 8 with the auditory exam. Cranial nerve 9 and 10 with the raising of the uvula. Cranial nerve 11 with the shoulder shrug, and cranial nerve 12 with the symmetrical movement of the tongue and also to the right and left. We'll move on to the sensation portion of the cranial exam. Just close your eyes. Tell me if this is equal on each side and present also.
Yes. 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 Yes.
Front of the leg.
Yes.
Back of the leg.
Yes.
Top of the foot.
Yes.
Okay, good. Okay, next we're going to move on to the musculoskeletal exam. We'll start with the reflexes. Brachial. Good. The patellar. And then the Achilles. Good. And then we want to check the strength of the cervical spine along with the lumbar spine. If you could just put your arms up like this for me, push away and pull me in. Arms like this to your side, push out and pull in. Wrists up like this, push your wrists towards me and away. Good. Hands like this, don't let me push your fingers in. And fingers like this, and we'll do each one, don't let me pull them apart. Okay, very good. And now with the legs here, I'm going to check the lumbar spine. Push your leg out one at a time. Very good. Dorsiflex your feet. Don't let me push them down. And plantar flex. Very good. We're going to check here your EHL by having you raise just your big toe. Very good. Arms across for me. Raise your leg like you're marching. Very good. And then if you will, just step on down, place your hands on the table, and raise yourself up on your toes, one leg at a time. Very good. Okay, you can have a seat back up on the exam table. Well, Kevin, thank you so much for letting me examine you today.
Thank you.